Hello, I'm Kate Pagan, I'm the Chief Nursing Information Officer. The videos you will see next contain my friend and colleague, the late Dr. Paul Southern. He was the key driving force in the EPR programme and was passionate about patient care and safety and the way that it supports it. We felt that continuing to use these clips would be a good way to continue his legacy. I'm sure that he would be very proud to continue to be a part of this important programme.
Hello, my name is Paul Southern. I'm the Associate Medical Director for Informatics. Today I'm going to talk to you about auto texts. I'm going to show you how powerful they can be and how to set them up. So if we turn to the screen, and I'm going to jump into clinical notes just to provide an example. So I click on menu, click clinical notes, and I create a new clinical note by clicking add. In this example, I'm going to select clinic letter. As you can see, I've reduced my number of choices for note types just down to ones that I actually use. In this case, I'm going to click clinic letter. The benefit of this is that when we use clinic letter, the letter goes straight off to the GP. So as you can see here, it's already got the patient's name and the GP in here. I'm going to simply go into the body of the text. I'm going to use, in this case, hashtag FT. And this brings up a fast track note type that I use regularly. So the patient is referred on the following basis. I'm going to say anemia. Endoscopy is carried out, and normally I then just cut and paste in the result of the endoscopy from the endoscopy system. The outcome, the following tests have been requested, and I'm going to say I've asked for a CT thorax and an ultrasound scan. And then by signing this document, that goes straight off both into the system for further review in the future if this patient comes back up to outpatients. So here's that letter we've just created very quickly, but also gets sent straight to the GP. So how do we create these auto texts? So once again, let's go into clinical notes and create a blank form. It doesn't matter which you choose. In this case, I'm going to just use gastro progress note. Looking at this top bar here, you select the button that says Manage Auto Text. Click that. This brings up the Manage Auto Text box. And here you can then choose to make your own new auto text. So for example, we click here, Add New Phrase. The first thing you have to do is give it an abbreviation to call it up. Within the system, you use a non-grammatical text. So for example, a full stop calls up the A&E ones. A comma calls up the pediatric ones. So you can use something else. I always use hashtag. And I'm going to call it hashtag test. And I give it a description. So I call it test for fast track. It's always worthwhile clicking show advanced view. This brings up auto text both within Message Center, PowerNote, and also within dynamic documentation. So we can start off now. I've just made that screen larger, and we're going to create some text. So we're going to say this patient attended for a fast track examination. Now I might want to add in something like the patient's allergies. To do that, I go to this button here that says Insert Templates or Tokens. Click it once, and I select, for example, allergies template. Click Insert, and that puts the template in. It's worth noting that these templates aren't titled, so you need to add in something like allergies here. So we put some allergies in. We then might want to add in the current medication. So again, click Insert Templates and Tokens, put in medication list. And again, we just need to make sure that we title it. So we'll call that current medication. I might also want to think about what I found on examination. So again here, you click this button that says Create Drop List. Click it once. I'd always recommend that you use blank default to start with, so click that first. And then Add List Item. And I'm going to say unremarkable examination. I'm going to add another one and say hepatomegaly. And maybe a third, enlarged spleen. I click create and that box is there. And again, you've got to remember to add a title in. So I'm going to put in here examination. I could keep adding in drop down boxes, but I won't. We might add in some further information. So here I'm going to say, please be aware patient is on a fast track pathway. I want this to stand out, so I'm going to highlight it, make it bigger, I'm going to make it bold, I'm going to underline it, and I'm going to make it red. So all the normal things you can do in Windows. So in this we've created an auto text that puts in the allergies, the current medication, has some drop down boxes and has some important information there. The last thing I do before I save it is click convert to HTML. You can see this button down here and that makes it available in the dynamic documentation types. We click save and I'm just going to say yes in this situation. And then I'm just going to close this and we'll see what it looks like. So without going into our progress note, we're going to click hashtag test. There we go. Patient enter for fast track examination, no allergies, current medications there, examination, I'm going to say hepatomegaly, and I'm going to sign it. So that was a brief tour of how to create auto text. As you can imagine, the auto text facility is really powerful. It can be used for creating auto text when you see patients. So for example, in outpatients within the clinician workflow system. It can be used if you're starting a patient on medication. So for example, when I start patients on steroids, I have a hashtag steroid that lists all of the things that I warn patients about when I start them on that medication. Similarly, from a surgical point of view, you could use it either within documentation with the operation notes, or you could use it when you're counselling somebody about surgery.